Welcome to our presentation for the Community Health Assessment. We were instructed to look at Catawba County, and we decided to investigate breast cancer in the Latino population. Just some fast facts. Catawba County ranks 41st out of 100 counties in North Carolina in the health rankings. According to 2010 census, population is 154,810. Catawba County lies northwest of Mecklenburg County in the Piedmont region of North Carolina. 9.2% of the county identify as Hispanic or Latino. And the leading cause of death in Catawba is cancer. In our assessment, we found that 30% of county residents live in rural areas. There is a good level of education, as 89.97% reached four-year high school graduation. The unemployment rate is 5.2. In poverty, 15.3% of residents live below the poverty line, and 23.4% of children live below the poverty line. 14% of households receive EBT food services, and over 57% of the students receive free or reduced meals. The income level in Catawba is $45,397 median household income. You can see that more than 50% of households live under the $50,000 level. Hispanic Latinos are at a disadvantage economically in Catawba. 36.5% of this population is living in poverty, this according to 2014 statistics. That's more than 20% of the poverty in the Latino community, despite the fact that there are only 8.4% of the total population being Latino. So the economic disparity gives us some context about how poverty impacts the needs of the county population overall. And this also shows how poverty can disproportionately impact minority communities. Let's look at the children of Catawba County. Approximately 21% of students, three school districts, speak a language other than English at home. More than 8% of students have limited English proficiency. So obviously this can affect their achievement in school, the social development, and as well as the graduation rates. In Catawba, only 56% of limited English proficiency students graduate. And in Hickory Public Schools, only 41%. Our windshield survey provides us with more information. There are 11 Hispanic churches in the Yellow Pages, and there are 20 Hispanic grocery stores listed in the Yellow Pages. There are 20 medical centers listed in the Yellow Pages. As far as housing goes, 15% of houses have at least one of the following problems: overcrowding, high housing costs, or lack of kitchen or plumbing facilities. 86% of commuters drive to work alone, and 23% drive a long commute alone. Grocery stores and churches are the main places Latinos meet, visit, and exchange information. Next, we'll look at epidemiological data. Following is the cause of death rate per 100,000 people. Cancers in all sites account for 206.9. Heart disease follows closely with 206.3. Chronic lower respiratory disease such as asthma and COPD, 74.8%. CVAs, 53.7. All other unintentional injuries, 35.9. And you can read the rest of the statistics here about diseases that kill residents of Catawba County. So in Catawba County, there are two main concerns. There has been an increase in breast cancer mortality from 2009 to 2015, especially among minority women. Data shows that 22.43% of all cancer diagnoses in 2014 were made at stage 3 or 4, obviously affecting the treatment of cancer. 66% of Medicare patients get mammography screening. Our team interviewed Scott Lindler, who is a manager of imaging at Catawba Mammography Screening. Their mobile unit sees a good number of Latinas. He states that upwards of 75% of the women that they see are Latinas. Language, of course, is the biggest barrier. The mobile units do have a bilingual receptionist. They use in-person and FaceTime translators at the imaging center. However, some of the patients are hesitant to use the iPad translators. They have a program called Health for Us. It's community outreach in lower income areas. They are involved with March of Dimes. They provide Spanish-speaking literature, and they provide charity care as they are a nonprofit. Our team made the following nursing diagnoses. First one is language barrier related to minority population, being primary patients screened in mobile units. Patients are at risk for not seeking care related to ineffective communication. So we need to raise community awareness of the problem via pamphlets, brochures, billboard education in Spanish language to make the community aware of all the health services that are available. There's also a risk for population not seeking care related to minorities not being able to communicate without an interpreter in person. So we suggest placing ads in the newspaper, submitting a request to local news station for needs of an interpreter, and raising awareness in the community of this need will, in hopes, increase the minority population taking advantages of services, as well as lowering the statistics related to breast cancer mortality in this population. Our third nursing diagnosis is risk for misdiagnosis of breast cancer because of gaps in transportation. We suggest nurses and staffs advocate for free public transportation to preventative healthcare screenings. Next, finally, the risk for minority populations not seeking preventative care and treatment related to financial responsibilities, like a high copay or not being covered by insurance. So our intervention would be to develop an outreach program to raise awareness of charity care, payment plans, discounts, and if the population isn't aware of these resources, they may fail to seek care in preventative medicine. So in conclusion, the incidence of breast cancer is on the rise in Catawba, and language barriers seem to be the #1 stumbling block for preventative care. Mobile units utilized in low-income neighborhoods and towns. Educational materials in Spanish need to be widely distributed. The uninsured need to know about low-cost and no-cost mammograms. And nurses at hospitals and clinics should ask questions about when patients have had their last mammogram.